The university announced today that all classes will be moved online following spring break.
Today, the World Health Organization officially announced that this is a global pandemic.
We're already looking at blueprints about how can you separate these desks 6 feet apart and creating classroom environments that fall within the CDC guideline.
I'm out here from the True Center, the True by Hilton Hotel here in Burlington, where we do know that Elon students are in quarantine.
Elon University now in level 3, or the high alert level, after an increase in coronavirus cases.
For the first time, Elon University will rapidly test students weekly beginning tomorrow.
Elon University is administering 300 doses of the Johnson & Johnson vaccine as part of its continued vaccination efforts.
The university will continue to require masks indoors beyond the original August 29th deadline.
Can students expect a potential booster requirement just for the spring? It's very possible.
The first time in nearly 2 years, Elon students are attending classes without masks.
Well, hello and welcome to this special coronavirus coverage here on Elon News Network. I'm Baylor Rodman. Just over 2 years ago, I sat at this very desk to report on President Book's announcement that Elon would be suspending in-person classes for 2 weeks. At the time of that decision, there were 8 cases of COVID-19 throughout the entire state of North Carolina. Well, 2 weeks turned into the rest of the semester. After a pledge from administrators, Elon was one of 23% of colleges to return to in-person instruction for fall 2020, coming with new rules, regulations, and requirements. As campus life starts to feel more like normal, we're looking back on the decisions made and where Elon looks to the future. Joining me now for this roundtable discussion is University medical physician Dr. Ginette Archinal and chair of the Healthy Elon Committee, Jeff Stein. Thank you so much for being with us today to have this conversation.
Our pleasure.
Thank you. So I just want to start for viewers, watching. You are interpreting the science, giving advice to as the advisory council to the policymaker and decision maker as we see in the future. What has been the Healthy Elon Committee. Now I know there's this running joke around Elon, right? We're one big bureaucracy. There's thousands of committees. It feels like there's subcommittees for each committees. There's even a committee on committees.
That's true.
Yet at the end of this academic year, the Healthy Elon Committee is being dissipated per your announcement last week. So why that decision?
Great question, and I want to start first by saying thank you.
Sure.
We just saw some of the video that was running, and ENN has done great work covering this. In what we all have said is unprecedented, and you all have gotten the word out over the last 2 years and asked us hard questions, and it's been better for the whole campus. I think we're seeing that we are reaching a point where we can move to the next phase, right? We're past the emergency phase.
Sure.
We can have some structures in place, but we don't need the Healthy Elon Committee meeting every week. We don't need the data team meeting twice a week. We can manage this as we would flu or some other things. We'll still keep our eye on the ball and still be watching to see what happens, of course, and if need be, we'll have groups come back in and add other structures. But I think now is a time we've got folks boosted and vaccinated, and things are going well.
Sure. So how were you involved in that decision at all, or advice to that?
Absolutely. Everybody
Sure.
on the committee was involved and had input. One of the goals of the committee, as everything sort of progressed, was really to not just handle this pandemic, but to have structures and systems in place for the next pandemic. A lot of people on campus don't realize that we already have an infectious disease committee, which existed before COVID and was absolutely totally important when we were handling mumps on campus. So we already had some things. It's just the pandemic created a need for more things that we hadn't addressed before. Now we have all that in place. We can go back to what we already have on campus,
Sure.
knowing that if something absolutely unexpected comes along again, we just click everything back into place. It's not like all the work's gone away.
Exactly.
Or forgotten.
And infectious disease will be watching.
Yeah.
It will be the structure that'll watch.
Yes.
We'll recharge and sort of reconstitute that group a bit,
Yeah.
so that they can be looking at the data.
I know one of the concerns amongst faculty and staff, especially when we were thinking about, and made the decision to get rid of the the mask requirement. We definitely didn't get rid of the vaccine requirement. Although we'll talk about that later. But getting rid of the mask requirement was that there's just going to be this total tone that, the pandemic's over and we're moving on. So are you afraid, though, that this decision from a communication standpoint, saying we're getting rid of the committee is essentially telling the community COVID's over, we're moving on?
I don't think so. This committee is honestly probably a little tired, and we're ready for new people to come in and be thinking broadly about health, wellness, and any sort of pandemic that would come forward. So part of it is giving this group a break and bringing some fresh folks off the bench. But I also think we'll be clear. We have a website. We'll be communicating if anything occurs. I could see that people would worry about that, but there will be plenty of information coming, and we'll be keeping track of things. So I don't doubt that we will be on top of this.
We'll be on top of it. Also, getting rid of the committee is, well, not really getting rid of it, but having it go into hiatus is just a recognition of where the world is now and where the community is, where everything is. It's a little naive of people to think that just because we're no longer going to have the active Healthy Elon committee, that all of a sudden everything's going to fall apart, or that having the Elon committee, suddenly Healthy Elon committee had some sort of magic wand protective bubble ability. We didn't.
So in terms of, though, the specific person that someone could look to and say, this is the specific person making the decision, even when it was the committee, I think we always assumed it was you as chair of the committee, but obviously I would imagine the President Book had a pretty heavy influence.
Senior administration.
Senior administration. So who is the go-to person to say, this is the person going to make, who is the final stamp of approval to make these decisions? Is it yourself? Is it President Book? Is it the Board of Trustees?
So over the last 2 years, it's been sort of a number of groups that have been working together. Any decision like this, as you know, we're consulting with local health officials, state health officials. We're working through the institution. The Board of Trustees, to answer that, doesn't necessarily manage day-to-day decisions. We communicate with them, but Healthy Elon was working with senior staff to make decisions and really getting input from across campus. I think part of your question is about what's next.
Yeah, sure.
And infectious disease has always been led by Dr. Janelyn Patterson, and I imagine that will continue. Dr. Archinal is a key player in that, working directly with Dr. Patterson, and they will continue to follow the same sort of pattern of reviewing information, consulting across campus, bringing that forward for decisions. Would you add anything to that?
Only that we work very closely with the local health department as well, and always have done, because we don't make these decisions and have these discussions in isolation. Again, it goes back to, we're not a bubble. We don't have some magic protective thing for Elon. We are part of the whole community.
So it's fair to say, even as we move forward, it's going to collectively be a group discussion, whether no matter what that may be called, which we may not know yet.
Correct.
Ready, resilient, healthy Elon. What's next? Do we have a new ring yet? Not yet.
No, I think we
could have a competition. What would you suggest we call it?
Well, I don't know. I can start brainstorming, I'll tell you that. But listen, we spoke to some students on their reactions to how the university handled COVID operations over the past few years. So let's take a look to that now.
The fact that they made sure to say that people should respect people who want to keep wearing masks and stuff was really good.
I think the university handled it pretty well. What I thought they could have done differently is be more transparent.
For this year, everything's been, I think, as normal as it could be. I still got to go to the gym, go hang out with friends, do everything as normally as I could compared to how it was in high school.
I actually gotten COVID 3 times this year, so I think they've done a very, very poor job.
Okay, so how do you respond to some of those students with their concerns there, or what they felt like worked too?
Yeah, this was new ground for us. I think that I've said to you many times, we made some good decisions, we made some imperfect decisions. There was no roadmap.
Right.
Again, I think this community came together. Last year, not this current year, but last year we had a lot of restrictions. We didn't know exactly what we were facing. And everybody chipped in and we made it work. This year, as one student mentioned, it was great that we were able to reduce restrictions. I think sometimes people forget that vaccines and boosters are there to stop serious illness and hospitalization. They don't necessarily stop us from getting infected. And so that's something that we had to watch and support as students, faculty, and staff did get infected, and make sure that nobody crossed over into that category of serious illness or hospitalization. But I think it's tough. We tried to rely on the science, alert people in advance, and keep people posted. But I think it's tough on a community to go through something like this. I would expect there to be lots of criticism because we weren't all in charge of our own destiny and our own fate every day. And we had to pay attention to others and trust. You asked a question earlier about people are worried no one's paying attention. Every phase of this, people worried about, is this the right decision? I just appreciate that people were honest about that.
So what do you think some of those decisions were that, looking back on, you think that maybe, didn't work?
Well, I'll tell you one more thing I would say is one of the students criticized transparency, and I think we were better last year about talking to lots of folks in advance before something came out, meaning even talking to campus leaders, this is about to come forward, we want to make sure you know, even if it's an hour before, right? But just communicating. I think this year we did a little less of that, and that was a critique I would level against us. I think the big decisions this year, remember we brought back masking as we had to with the Delta variant this fall. We shifted to requiring vaccinations, and those who weren't getting vaccination who could get an exemption, that they could get an exemption, but they would have to test weekly. I think that was tough on some members of our community. And then we moved to the booster. I think those were all big decisions that had a lot of impact, that were probably hard on people. I think we probably made the right decisions, and we've turned out to be very fortunate.
I think we've been lucky. I remember right at the beginning of all of it, a parent discussing concerns with me and asking how we were making decisions, and I remember saying, it's like looking through a really, really cloudy crystal ball. Sure. And that's the reality, and that crystal ball is still hazy. And I think that's where sometimes the issues about transparency, where people thought things were not necessarily transparent. It's impossible to be totally transparent when the external things are changing day by day or hour by hour. And I think we did the best we could.
Was there any point of advice that you gave that you felt like wasn't fully listened to that should have been?
I think everything I said was listened to. I did not necessarily agree with everything, but nothing was ever done that was contrary to medical science. Opinion is different from fact, and everybody's entitled to their opinion. I think everybody on our committee had different opinions about a lot of things. Those opinions were listened to, but at the end of the day, we went back to facts and data, and that's all we could do to protect the community.
As we're in this and kind of phase out of the pandemic, what do you, from a health perspective point, what should we be doing now that maybe the campus currently isn't doing, not necessarily in terms of policy, just but in terms of students day to day? Is there still a major cause for concern?
Okay, I keep telling people, and anybody who's seen me in the office recently has heard this, one of the things I want people to take from COVID is that wearing a mask, washing your hands, not gratuitously hugging strangers, not sharing drinks, actually stops you getting sick. Not just from COVID, but from everything else. Play back some clips of heading into flu season from ENN over the years. Every year I say, don't share drinks, wash your hands. That's the thing. That's one of the reasons we're seeing more COVID generally in society now. We're vaccinated, we're boosted, we're not going into hospital.
Sure.
But we are getting mild cases of COVID because we've relaxed all the rest of it.
There's one thing too that I've heard from just frankly a lot of students who say, I feel a little sick today, but it's it's a sore throat. Some of those students rush off to get a test. Some of those students say, I'm just going to stick it out. You have a lot of students who say, I'm only testing positive if I go and get tested, which kind of leads into my question about asymptomatic testing for the future. Is that something that we still expect to have on campus, just free for any student who wants it, or is that sort of in some cases, students only know they have COVID because they've just gotten tested?
Well, there's two issues there, because you said students who have a scratchy throat but don't necessarily get tested, and then you mentioned asymptomatic, so they're actually two different groups.
Okay.
And the communication from John DeLoughy and from Healthy Elon and moving forward is going to be, if you feel sick, wear a mask. Don't try and parse, is it COVID, is it allergies, is it a bad cold, is it, whatever. Just wear a mask when you're around other people. Basic, common respect for other people. And that's, I think, the first step. And as for the asymptomatic testing, you know, I wish everybody could answer that question. I mean, you know, nobody has an answer to it.
Right. But I think you've helped us to see that we're moving from asymptomatic and symptomatic testing in some ways to, if you're sick, if you feel sick, go get checked. And that's a sick visit.
Exactly.
And the medical professionals will help us determine.
Yeah.
But for right now, we have asymptomatic testing through the summer. We'll make that decision about fall, just to come back to that.
Okay. All right, well, we've got to hit a commercial break, but when we come back, we've got more discussion with Jeff Stein and Dr. Archinal about vaccines, mandates, and more. So stay with us. All right, well, welcome back. We're still joined here by Dr. Jeff Stein and Dr. Ginette Archinal. Thank you so much for being with us as we make decisions about the future. We reminisce about the last 2 years that it's been. I want to move now talking a little bit about vaccines and not only requirements, of course, that were in place for this year, but as we look ahead to the future. Of course, I know it's hard to answer some of those questions as we, this pandemic has taught us a lot. We don't even know what tomorrow looks like in some cases, so it's hard to look in the future. But I want to talk about vaccines and the requirement, and specifically the booster, in the sense that you have the FDA coming out this week talking about the Johnson & Johnson vaccine, which obviously was one that here at Elon, we were really pushing for students in the sense that it's one dose and it's quick and easy done. Well, now they're highly restricting that vaccine as it's a very rare form, but still potentially it seems can cause some severe blood clots. So is that something that students should be concerned about? I know some students who say, I got the J&J and boy, I just feel like, what was the point? Or here's the end. I mean, that's what you have students saying across campus. So how do you
absolutely.
address that?
The way I address it is the way we addressed it when we were offering the J&J. At that point, we knew that the risk of these particular types of blood clots from COVID was much higher than the risk of getting it from the J&J vaccine. At the same time, we had to look at how do we vaccinate, how do we keep people out of hospital, how do we keep people from dying? And that was really very much, it was a risk-benefit discussion. And that's a discussion I had with plenty of students on campus. They can probably, there are probably students who remember me having that conversation with them. This is a different era now. We now know that the messenger RNA vaccines are very safe. We didn't know that then. I mean, we hoped. We did our best. I had the messenger RNA. But, there was so much uncertainty. So, but this is a year later. We have so much more data. Why have a vaccine that has more risks if you don't really need it? That's different from have a vaccine that may have slight risks versus a much higher risk if you get the disease.
Sure. So, well, we talk about uncertainty, and as we're uncertain about what the future of the virus looks like in terms of variants or whatever, and as we pointed out, in some cases we're uncertain about future studies that come out with these things. So, from a decision standpoint, does it worry you about mandating certain vaccines that then we don't know what could potentially come out in terms of study for them in the future?
I would turn to Dr. Archinal, but I'll just say I think we have seen repeatedly these are safe vaccines, and as Dr. Archinal just said, the risk of something adverse happening is much, much smaller. Very rare and much, much smaller than the risk of getting COVID. And so any decision like this, of course, we're concerned and we're looking at all the research and the science, but I think in these situations you make the best decision you can based on those who are really studying the vaccines, not those who are talking about it, not those who are, necessarily concerned one way or the other, but those who are really studying. And I think, to go really to the heart of what your question might be getting at, we're at a point where we're waiting for the CDC to make some decisions for next year. We had hoped that would be sooner, so we were waiting to make decisions about what we would have to require, if anything, next year. I think it's clear that the CDC will not be coming out with, or the FDA will not be coming out both with anything in the next few weeks. So we'll be forced to make a decision about what are we going to require of incoming students. And I expect that decision to come in the next couple of weeks because timing-wise, we just need to decide, are we requiring that for the original vaccines and booster for incoming students or not?
So when we talk about, specifically the booster for this semester, on December 27th, when the email was sent to say that we were going to be requiring the booster for students, the language in that email said the CDC and many health experts now have evidence that full vaccination should include a Pfizer or Moderna booster shot. So based on that guidance, all Elon students are required to receive a booster vaccine and upload their documentation as soon as possible and no later than January 1st. But just after that, on January the 5th, the CDC said that they had no plans to change the definition of fully vaccinated to include a booster shot. So from a decision standpoint, was that misleading to students, you think?
Do you want to talk about the medicine and then I'll jump in?
It was honest when it was written. Part of the difficulty is that even the CDC changes its mind.
We're seeing that a lot these days.
The FDA says things. The data from other countries was saying things. So it was honest and transparent at the time it was written. I still stand by that medical advice that full vaccination did include a booster dose or a messenger RNA dose if you'd only had the J&J, based on what was coming out all over the rest of the world. Sure. Some of the best research still on COVID vaccines and efficacy of boosters is coming out of Israel. And we looked at all of that. It would have been very, very easy for us only to look at the CDC. Now, obviously, we ride on the CDC and our local health department because we're in the US, but we looked at the rest of the world as well. Getting back to your question you said about mandating particular vaccines, we didn't mandate a particular vaccine. It was vaccines, and we were very careful not to restrict what vaccine people wanted. Elon, unlike a lot of other places, accepted any vaccine that was approved by WHO. So we have students who got AstraZeneca vaccine because they were in the UK or Europe or Australia. Now, it was never approved in the US because it had a much higher risk of blood clots than the J&J vaccine. Sure. But we have students who had all sorts of vaccines. If they were approved by WHO, we accepted them. We even accepted a couple of students who had the Nova vaccine because they were in the trials in the US. We tried to make it inclusive and not restrict anybody to anything particular. And that's really been our approach. Focus on what the US is recommending, but not ignore the rest of the world either.
So I know, again, it's going to be hard to answer, but we did speak to a few students about their thoughts on future operations, as well as the potential of another booster requirement for some students, a fourth jab. So let's take a look at that.
They deem to have the best effect on the students. I think that's great. So I think that student health should be the utmost importance.
I think they really have the right to ask people to do it.
I think they should just keep doing what they're doing. I think they're doing a good job, in my opinion.
That could be doable. I really don't think there would be a ton of pushback from students. I think that a lot of us are really willing and open to keep each other safe.
Making it super clear what everybody needs to do and how everybody needs to continue to follow the protocol, even though we're not necessarily wearing masks in class anymore, things like that.
I wouldn't mind. I mean, we've gotten the vaccine and the booster so far, so that's what we got to do to keep the masks off. That's cool with me.
I've gotten 3 shots. I don't really know if I want a 4th.
It's a pretty mixed reaction across the board. Just your reactions to what some of the students said?
I agree with all their opinions. There's still a lot of discussion. There's, at the moment, a 4th dose is not recommended for everybody. That will probably change. At the moment, the work on vaccines is looking at multivariant vaccines, changing the strains, recognizing that, Omicron, for example, and the subspecies of Omicron we're not protected as well against them from the current vaccines. So there's a lot going on.
Sure.
And this goes back to the CDC not making a decision until later this summer. From what I'm reading, there may be a vaccine that combines aspects of Omicron, Delta, as well as the original, available in the early fall. Now, if that's going to be the case, then the CDC is probably going to say, hold off on getting a booster unless you're in a high-risk group, until the fall and get it with your flu shot. It goes back to that looking through a crystal ball, and it's still very hazy.
Well, can I just say, I thought the students' comments were really interesting because there was some sort of ambiguity, right? Some said, hey, if this is what's recommended, let's do it. Others, I don't know, right? But I think one thing you saw there is they were expecting clear communication. They were hoping that things would become more clear from CDC and others, and they're desiring that clarity, like the rest of us. But I thought it was really interesting. There was no one who said, no way, but also there's some reticence. And I think that we need to respect that.
Sure. And it's not only for students on campus, but for over the 1,700 students who've already signed their deposits, paid their deposits, and are coming to Elon in the fall. Obviously, we would love to talk about specific scenarios that we can implement. If you have any ideas on what some of those scenarios could potentially look like to share, great. But I know it's probably hard to answer that question.
For the incoming students?
Yeah, for the incoming students. But also, what are you telling those parents who are trying to grapple with the fact of, do I send my student to Elon based off of this issue? What
we have been saying, and what went out in admissions materials, was here's our current policy, and we haven't yet made a decision or received guidance on what we'll need to do next. So we wanted to be clear, this is what we've done, and these are the current expectations on campus. As I said earlier, we were hoping that we'd hear from the CDC and the FDA sooner. I don't expect that we'll hear until sometime in summer, at soonest. So we've tried to communicate, and one of the questions that's come up is, well, actually the questions have been on both sides. Is my student going to be safe, or are you going to require my student, and can they get an exemption? And so we've tried to meet them wherever they are to explain how we've handled things in the past and give them a little flavor for our approach, even if we can't give them the exact,
to try and say, these were the scenarios that were implemented this year. Right. This is something that you can at least totally expect for next year. All right, sounds good. Anything to add?
I was just going to say, human beings aren't machines, and neither is the virus. So you can't treat them as if it's X, Y, and Z. There's always randomness. And I think the important thing is to be honest that it's randomness and to say, I don't know if you don't know.
And to listen. A lot of concerns out there, and people need to be heard.
Yes.
Well, we thank you for listening for us. We're going to take another quick break. When we come back, we've got more on what we've learned and how we're moving on with Jeff Stein and Dr. Archinal. All right, well, welcome back inside the Jane and Brian Williams studios. We continue our coverage here on the coronavirus 2 years later, having a roundtable discussion with Jeff Stein and Dr. Ginette Archinal. Thank you again for being here. So just taking around the table, what is really, the biggest thing that you've learned over the last 2 years in these roles that you've really taken on?
I think we've learned a lot. We learned that together we can get through a pandemic. We learned that we can try new things, we can make mistakes, come back and really make it work. We had no roadmap, as I said earlier. And this was not a one person, sometimes I get identified with Healthy Elon. This was faculty, staff, and students across campus, right? From the people who put the plexiglass up to the people who were giving vaccines or tests, to all the IT folks, physical plant, you name it. So together we can do all that. The other thing I will say is that something from our prior block, every single individual had different needs in this. And it takes extra time and care and attention, and we don't always do a good job of that, but it really takes that extra care to pay attention to those individuals. I also think trust in each other and in our institutions is waning, and that made things difficult for people to know how to proceed.
So how do you bring back that trust, though?
That's a great question, and I'm hoping that you have an answer. I think we have to keep being one-on-one with people. We have to keep being transparent, as the student said. We have to keep asking people their opinions and trying to come together. It'll take time. It really will. It's been a hard 2 years. I think you saw in those videos that students are tired. Everybody's tired. The Healthy Elon committee is tired, right? And that's just, I think everybody had their personal lives and they had Elon, right? And for students, sometimes that's enmeshed, but sometimes it's not. And I think that was a lot to take on, COVID was, for 2 years. But I think this is the work in front of us, is how do we build trust in each other?
Yeah, just to talk about how it's been a lot for a lot of people, and I would imagine you've been dealing a lot with just the mental health of students. And so in addition to your reflection, I'm wondering if you can touch on that, and how are you concerned about the mental health of students after the 2-year drain?
Not just students, but also faculty and staff. In fact, on some levels, I think it was even more difficult for faculty because they had young children at home. They might have a lot of, unfortunately, we have an aging faculty. in a lot of areas. They have major health issues. Our janitorial staff were exposed to a lot, and people who were working shift work didn't necessarily get access to all of the information in as timely manner as those who were here, 9 to 5 essentially. So it's the whole campus. I was concerned, am still concerned about mental health. Nationwide, anxiety and depression went way up. Alcohol use went way up in all age groups, particularly 18 to 35. There's a lot of stuff, and we will be dealing with this fallout for the next couple of years. I think it behooves everybody to understand that. I hope, I went back to, from a medical perspective, I hope everybody from COVID takes wear a mask, wash your hands.
Sure.
I hope the other thing people take from it is we need each other, we have to rely on each other, we have to look out for each other emotionally as well as physically. I think there was a lot of that really went well on campus. I was blown away by the support that students gave other students when they were sick or even when they were worried. But it's an ongoing problem, and it's going to be an issue for the next couple of years.
So, with you, looking ahead to the future, as you said earlier, you're really been known as the chair of the committee, the head macho of COVID. But your initial role is, your official role, I should say, is the Vice President of Strategic Initiatives. So we were joking earlier about what are we branding next year as ready for Healthy Elon, whatever. But I mean, it's always been your job to look 10 years into the future. Right. Is that something that you're going back to, looking more in terms of a decade down than just a year down, or
yes,
what will your role be? Really?
We're working to get back to focusing on boldly Elon. I said at faculty meeting the other day, the beginning of a strategic plan is usually like the beginning of a horse race with mud flying everywhere. It's loud, it's chaotic. The problem over the past 2 years is we had another horse that was going around the tracks causing a little trouble and gathering attention. But so we've held back a little bit on boldly Elon. But I think you'll see the mentoring initiative will really kick up next fall. I think a lot of focus on health and well-being through the strategic plan, as well as a number of other areas around DE&I and faculty staff wellness and well-being. But we will, yes, shift, and my role will shift in that beyond COVID. And we'll always be ready if something comes up as well.
Look forward, though, one of the things I have to say I've just noticed walking around campus is that it just feels quieter. I just don't see as many people. There's been a lot of students have said, I'm not seeing the drive as much of students, and I think, as we've said, people are tired. But are you worried about what the everyday life looks like in terms of, the rigor of students taking on advantages across campus? Or, just from my personal interactions, I've seen a lot more of waking up, going to class, going home. That's not really what Elon's about, right? As we know of the tremendous hands-on experiential learning experiences, one of which playing out today. So is that a concern of you in terms of looking to the future? And how do we start to get back to Elon?
Can I just jump in there?
Sure.
Prior to COVID, one of my concerns for the emotional health of students was this culture of busyness on campus.
Doing too much, yeah.
People felt if they weren't doing something 24 hours a day, there was something wrong. It was too much. Right. So, and you're quite right. It's swung the other way with COVID. I'm hoping that moving forward, that's part of what we do. We find that middle ground.
And I think we need to talk about that, right? Students, faculty, staff have discussions. I think we need to give people a little bit of a break over the summer for those who get to take a break and then come back together and really reassess. I do think it's a matter of pendulum swing, and we need to give ourselves time. Hopefully, we will come back healthier, and we'll use that to balance. But I don't think there's any question that people are making a little bit different choices and maybe not able to dig in as deeply as they would like. You see that everywhere, that people aren't attending events as much, those sorts of things. I think we will shift, hopefully in a more healthy way, as Dr. Archinal mentioned.
Sure. All right, well, as we close out today, what do you want students, faculty, and parents really to take away from this time? And obviously, we've been really talking about that all day, but in just a few lines, how do you want them to look to the future?
I would say thank you. I know I start and end always with this, but We might also say congratulations to our seniors and their families. Huge achievement to reach this point during COVID. But I would say thank you because folks weren't shy about sharing their opinion, about asking questions, and that helped us be better. But also thank you for folks for just chipping in across the board. And I think if I were to give a message beyond thank you, it would be this is a special community. We can do great things together. And we need to stay committed to each other as we move forward and look forward to great things in the future. This period will not define exactly who we are, right? Elon is bigger than this, each of us. And we need to be ready to continue to move forward.
Dr. Archinal?
Hey, no way I can top Jeff Stein.
In just a few words? No?
In just a few words. Elon's great. I will say, as part of American College Health Association, and looking at all the chatter on that for the last 2 years, I think Elon can be incredibly proud of the way it handled things. Personally, I'm proud of the fact that we really tried to be honest the whole way through. It's hard to say I don't know. It is very hard to say I don't know. And I know it frustrated people. But that, to me, was the most important thing. When we didn't know, we said, I don't know. And people, to go back to your thing, people trusted us. They accepted, okay, we don't know.
Yeah. Well, and hey, I mean, you've all thanked us in the beginning. And of course, we want to thank you just for being here today and constantly answering our questions throughout the last 2 years. And not only that you saw in that montage, but just doing this 30-minute discussion today. We always appreciate the time. And one of 23% of the schools that got back in 2020, and so we know that you're doing tireless work, but we thank you for answering our tireless questions as well. So that will do it for us today, but thank you very much for being here, and we will, of course, we'll continue to reconnect with you as the summer continues. So University Medical Physician, Dr. Ginette Archinal, and Chair of the Healthy Elon Committee, as we reshape that, Jeff Stein, thank you. You can follow us at Elon News Network for continuous coverage in the upcoming school year. That'll do it for us. Thank you. Well, thank you very much.
Thank you.